Hi, this is Jen Vonderau, and I'm going to show you a running subcuticular or running subcutaneous suture. I have my hemostat with my needle loaded in my preferred position in the latter half of the needle perfectly perpendicular to my hemostat, meaning the point is going straight up towards the sky along the y-axis when my hemostat is held in my preferred position, the natural position in the x-axis. I am holding on my trusty Atson, which is my device that I can use to expose the skin. And just for reference, I'm going to refer to a few different planes. We have the x-axis plane, which kind of like consider a tabletop. If you extended the x-axis in all directions, it would sort of demonstrate a field in front of you. We'll call that the x-axis plane, the horizontal plane, the longitudinal plane. And it's basically referring to dimensions that are further away from you, closer to you, to your left and to your right. We have the y-axis plane, which is sometimes called the vertical plane. That is the plane that is up and down, and more commonly going to find direction for us in regards to how deep or superficial we are in this wound. Superficial meaning closer to the skin, deep meaning deeper in the body. If you know the dermal planes of the skin, that you know we have the epidermis, the dermis, and then the further subcutaneous tissue. So we are going to be sewing in the epidermal space just below the skin. And I think the hardest stitch for this closure is going to be the anchoring first stitch. So again, I have my needle loaded this way. As a reminder, we always enter the skin in perpendicular. So if that means we're coming to on this side, our hand is going to be completely torqued in order to poke in, needle directly perpendicular to the skin, to allow a turn of the wrist to proceed. If we're going to go into this side, we're going to have our wrist turned just ever so slightly palm down so that we can enter the skin in perpendicular. Turn our wrist and come out through the top. Also, we're going to use our Atson held almost like a pencil. We're going to grab that tissue and expose and pull away. We're not just going to lift up, we're going to really expose. We're going to turn our wrist and pull away. Our Atson is almost always going to be below the needle, but above our dominant hand. Although I may sort of move it around when placing the anchoring stitch just to get good exposure. Again, we don't poke what we don't see. So for this anchoring stitch, I principally want you to recognize that in the top of this wound, in the x-axis plane, we have this long longitudinal wound, right? In the y-axis plane, though, we have the deep space of the wound, down way under here, and the superficial space of the wound, this tan fleshy color that is the color they made this skin pad that I bought on the internet. When we are doing this first anchoring stitch, we are going to stay in line with this wound as if I drew a line extending it, more away from us, and then back close to us in the same pattern in which we're going to start deep in the wound and then come superficial. If I could draw that in 3 dimensions, what that would mean is I'm coming in deep and pulling away, moving up superficial, and then coming close. So our suture is going to stay in line with this wound in this space up here. I'm going to expose so I can see this corner well. I have my wrist very torqued. I'm going to come in, moving the needle directly away from me, deep in this wound, turning my wrist so that the needle comes more superficial to the skin, and then torquing it around so that it comes towards me. Again, my Atsons are very bad pickups because they don't close fully, but you can see how I have a chunk of skin here that's really in line with the wound itself. Again, when we're suturing, we like to just like sort of pull our thread like this so we're not reaching our hands high into the sky. We are going to place an anchoring suture here. We're going to do an instrument tie because that's what's in our hand. I'm going to come from below 2 throws. Don't pull too hard because this is so fragile. From above, 1 throw. From below, 1 throw. From above, 1 throw. I'm going to leave this as my useful anchor, and I'm going to cut this tail with fine scissors basically as adjacent to this knot as I can. My scissors aren't that good. These are tools from my daughter's bathroom cabinet. So reload my needle in my preferred position. I have my anchoring stitch. I'm not going to pull too hard on it because honestly these suture pads never hold that well. But this suture is sort of categorically reminded as a ladder stitch because it should look like a ladder as we do it. So I'm going to throw my first throw by basically going into this corner, coming around and coming a distance further, closer to me in the x-axis horizontal plane. I'm not going in the deep space. I'm staying in the superficial space and moving my suture from here to here. How I'm going to do this is approaching the wound at a 90-degree angle with my needle, rotating my wrist so it comes around and out. Another way to facilitate this to make it easier is to expose and lift up in a way that you're torquing your wrist in an angled plane rather than just straight towards you. I'm going to go in the corner, turn my wrist, come out in the same plane, but about 2 millimeters closer to me down from where I began. To go from here, I'm going to reload again. Same load on my needle, but in this case, I'm going to come to the opposing side, which means I'm going to have to kind of hold my needle in a funny way, like this, to come around. So I'm going to expose, and I'm going to come in at the same place I exited from here. So see, I moved the distance of here to here. I'm going to come in on this side and try to come out here. Again, I'm going to expose so I can see a lot better and stay in the plane a lot better. I'm now out at this level. I've gone from corner to here to here. Let's keep going. I like to kind of remind myself where I began. Try not to grab the very tip if you can help it. Kind of smashes the needle and makes it a little harder to, the beginnings of a ladder here, makes it kind of harder for it to stay sharp. I'm reloading in the exact same way every single time, and I'm closing this every single time. Here's my reminder of where I came out. Expose, torque, torque, torque. Still got our ladder going. Let's do a few more. All right, you can see pretty clearly that we have a ladder suture, that when I pull taut, has a nice closure. I can't pull that too much because I'm gonna tear this. Sometimes you can get that little puckering in this sort of machine type of pad where you have like too much memory holding this apart. But you can see how that skin approximates nice and well.